Greetings and welcome to today's webinar. My name is Elena Kennedy and I am the Chief Operating Officer here at the Illinois Association of Medicaid Health Plans, commonly referred to as IAMHP. We are so excited to have you all for our October Lunch and Learn focused on the standardized roster. Before we dive into the presentation, I'd like to take a moment to walk through our control panel. IAMHP utilizes the GoToWebinar platform for all of our webinars. A control panel should have popped up on the right-hand side of your computer screen. At this point, all of you should be able to hear me either through your computer audio or your phone. Please note, if you are disconnected from your computer audio, you can dial in by your phone, and if your phone disconnects, you can change and utilize your computer audio. Should you have questions about the presentation or your audio and technical platform, you can submit those via the questions tab. I will be receiving all of those questions and will be answering those as we move along and be pulling those for the Q&A section. Finally, we do have our chat function. This is a great way for you to create community and interact with other attendees as well as the panelists. Please note, I'm coming up as IAMHP organizer or IAMHP admin if you'd like to direct those questions and chat to me directly. Please note that due to the version of GoToWebinar you have or your firewall protection, you might not be able to access the chat function. We apologize for that inconvenience and appreciate your understanding. Without further ado, I am so excited to start today's presentation, as this is truly an important piece to all of the things that we all do here at the health plans and with our providers. With that, as noted, my name is Elena Kennedy, and I'm the Chief Operating Officer here at IAMHP, and I'm welcomed by Latasha Smith, the Director of Provider Network Management at Molina, and Michael Auriglia, the Director of Provider Network Administration at Molina. They'll be diving into the presentation and providing additional color on the standardized roster, which was developed in part as an industry collaboration effort with the Department of Healthcare and Family Services, HFS, the Illinois Association of Medicaid Health Plans, IAMHP, and the Illinois Participating Medicaid Managed Care Organizations, also referred to as MCOs, the Illinois Health and Hospital Association, IHSs. And so without further ado, I'm going to hand it over to them to provide additional color on the standardized roster. Welcome, Latasha and Michael.
Welcome. Thank you, Elena, for that great introduction. Once again, I am Latasha Smith, the Director of Provider Network Management for Molina Healthcare of Illinois. I also have Michael Arriaga, who is our Director of Provider Network Administration, who's in charge of all our provider enrollment. I would like to welcome everyone to October's Lunch and Learn on the standardized roster. Who is IAMHP? As a member organization for the Medicaid Managed Care Health Plans, IAMHP works with the Illinois state government, legislative advocacy groups, trade associations, and Medicaid patients to invest in and provide high-quality health care focused on cost-effective, individualized care that helps the residents of Illinois live longer and healthier lives. The IAMHP plans in 2021 are Aetna Better Health, Blue Cross Blue Shield Community Health Plans, County Care, Meridian Health, and Molina. For MMAI, it is Aetna Better Health, Blue Cross Blue Shield Community Health Plans, Humana, Meridian Complete, and Molina. And we also have an addition for 2021, Youth Care, which is Meridian, with the name displays as Youth Care. Diving into today's subject, the standardized roster purpose. What is the purpose of the roster that we initiate among MCOs to our provider community? One, it simplifies credentialing. Under the new program, registering with the department's online provider enrollment program will become the only requirement to begin developing relationships with every Medicaid managed care health plan. Medicaid providers will need to only register with HFS Impact website. Once an application is approved by HFS, the provider is considered credentialed with the health plan. Please be aware of two important features of this upgrade. First, the change applies only to Health Choice at Illinois, which is the Medicaid portion, and MMAI programs. Second, although providers will be credentialed through IMPACT, they should continue to provide specific information requested by MCOs that is not included in the credentialing process, but is needed for MCO operations, such as provider office hours. Credentialing on its own does not mean a provider and a health plan will be doing business together. A provider and the plans must still enter into a contractual relationship and satisfy all necessary operational requirements. Registering in IMPACT. How a provider registers in IMPACT will directly affect how a provider is reimbursed by a health plan. Ensure that all applicable specialties are selected and submitted to IMPACT. It is paramount that the taxonomy numbers registered with IMPACT are the ones listed on claims and rosters to ensure payment. Currently, health plans do not receive everything a provider enters into IMPACT due to system limitations. Problems addressed by standardized roster. Inconsistent forms and types of information prior to rosters. It was a challenge for providers to complete the rosters timely and accurately. Billing errors were caused by incomplete and or inaccurate rosters. Members did not receive up-to-date information. Existing rosters didn't contain all the information needed for provider directories, meaning members didn't have the information they needed regarding office hours, ADA accessibility, and etc. The standardized roster background. The standardized roster was developed by a working group of Medicaid Health Plans, providers, and HFS. Instructions are standardized, format is standardized, data entry requirements are standardized. Health plans have tested the roster and began accepting them June 15, 2018. Health plans are working with providers to ensure they can complete the new roster format. Fields required by federal and state law were added to the standardized roster. The legislative requirement. Liability effective date means the date on which an MCO becomes responsible for payment for medically necessary and covered services rendered by a provider to one of its enrollees in accordance with the contract terms between the MCO and the provider. The liability effective date shall be the later of A, the execution date of a network participation contract agreement, B, the date the provider or its representative submits to the MCO the complete and accurate standardized roster form for the provider in the format approved by the department. C, the provider effective date contained within the department's provider enrollment subsystem within the Illinois Medicaid Program Advanced Cloud Technology, known as IMPACT system. 2, the standardized roster form may be submitted to the MCO at the same time that the provider submits an enrollment application to the department through IMPACT. The standardized roster is to be accepted by all health choice plans. The roster and instructions can be found on IAMHP's website under IAMHP.net under the Provider Resources page. The template seeks to obtain 3 categories of information that is required for contracting and provider directory. Information that is required only if applicable to your organization, information that is preferred but not required. If your organization would like training on completing the rosters, please let IAMHP or a Medicaid health plan know. The technical elements of the standardized roster. Here are some technical do's and don'ts. Roster completion. Recommended a monthly submission to all plans. Please check if plans can accept just change files or need full rosters monthly. Submission ensures that the MCO has information available. It impacts loading of new positions and changes to existing practitioners. The roster format, providers are asked to use the most updated roster format. The current format can be located on the IAMHP website at iamhp.net. Changes to the roster template. Do not delete columns or headers. Columns that are not applicable should be left blank. Do not state NA, as plans have automated the loading of rosters, and this may complicate the process. Additional lines can be added to reflect additional locations for the provider. Providers listed on the roster will be loaded by the MCO. Incomplete rosters. Providers without complete information on the roster will not be loaded by the MCO. MCO variants. The content, structure, and format has been standardized. Providers should still communicate with MCOs on their submission policy. Each MCO will have a submission policy that is specific to them. The effective date is the later of the date the roster is submitted, the date provider is contracted, date provider is effective in impact.
No, I'm good.
MCOs have 30 days to load already contracted providers once a complete roster is submitted. Where to submit rosters and who to ask for assistance varies at each MCO. FAQs provide additional details for MCO variants. The instructions listed on the first tab of the roster. This is a multi-tab workbook to be utilized across all managed care plans in Illinois as a roster template for providers. This document, though it's large, is one that will allow each plan to have the necessary information from providers to accurately load and represent their network. There are 3 different sections that may or may not apply to each group completing this workbook. Each sheet has certain fields that are drop downs. There's the status, the state, yes, no, male, female, etc. that are on the tabs of the workbook. Not all fields contain a drop down, and these are free text. Please utilize the drop down when appropriate. There's a tab prior to each green tab that outlines the data in the green tab and what is required of each field. All practitioners. This tab is relating to each individual practitioner in a group. Some practitioners will have more than one line to represent them due to operating out of multiple service locations. Please complete all required fields to each practitioner as appropriate. Group Location Practices tab. Group location practices are the service locations where providers treat patients. These locations do not double as a provider, therefore they do not have individual NPIs, licenses, and the like. Each location is required to meet ADA standards and to specify any limitations and services offered. Please complete all required fields related to each group location as appropriate. Facility. Similar to group location practices, this is a physical building. However, facilities tend to have the ability to bill direct as well. Each facility is required to meet ADA standards and to specify any limitations and services offered. Please complete all required fields related to each facility as appropriate. The Individual Practitioner tab. Existing data elements currently on the tab: practitioner information, license information, and board information. The data elements that are required by state and federal policy are location services, practice limitations, specialized training and experience, practice capacity, accepted gender, and minimum and maximum enrollees. The Group Location tab. This is the tab where Encounter Clinic information should be. The existing data elements for the group location tab are location, billing, and hours. The data elements as required by state and federal policy is languages, transportation access, practice information, completion of training, location of services, and detailed ADA information. The facility tab. Definition of facility is hospital, ACSs, which is ambulatory surgical centers, and PT/OT clinics, freestanding. The encounter rate clinic should not complete information on the group practice tab, should complete information on the group practice tab, not the facility tab. Updated roster. The updated roster format will be effective, have gone into effect as of October 1st, 2021. The updated roster currently has the changes highlighted in yellow so that you as a provider can easily identify them. The next few slides, we review the changes that have been made to the universal roster. The updated instructions tab. Clarity that waiver providers should complete the group tab and that an NPI should not be included. Clarity that encounter rate clinics should complete the group tab. The practitioner directions and data tab. New required data field to provide information on what change is being made. This change will provide clarity on interpreting and loading updated roster submissions. Requirement of the primary specialty taxonomy. This was previously preferred. However, it has been found that providers who did not submit the taxonomy on their roster had more billing and loading challenges. This change should remedy those issues. The group directions and data tab has new required data field to provide information on what changes being made. This change will provide clarity on interpreting and loading updated roster submission, clarification of the group NPI requirement. An NPI is not required, nor should it be submitted for waiver providers. Addition of the Medicaid ID for the group tab as required, if applicable, field. There is an especially critical field for waiver providers and encounter rate clinics. Requirement of primary taxonomy. This was previously preferred. However, it has been found that providers who did not submit the taxonomy on their roster did incur additional billing and loading challenges. Addition of the practice website as a required field. This will be published in the network directory. The additional tabs or information regarding BEP, the MVP, and WBE business certification as a required field, and location services. Options have been updated with the addition of new services. The facility directions and data tab updates. New required data field to provide information on what change is being made. To provide clarity on the interpreting and loading of an updated roster submission. Clarification of the NPI requirement. An NPI is not required, nor should it be submitted once again for waiver providers. Update to the Medicaid ID field as required. Requirement of the primary taxonomy, again, to decrease billing and loading challenges. Additional information regarding the BEP, MBE, and WBE business certification as a required data field. Addition of location facts and provider facts as required if applicable. Addition of the facility website as a required field that will be published in the network directory. Location services options have been updated with the addition of new services. Update to ADA details with the addition of not applicable for certain data fields that may not apply to all facilities. The BH Specialized Training tab. Addition of Part 2 provider as an optional BH Specialized Training or Experience entry. As we come to the end of the IAMHP Universal Roster webinar for our October Lunch and Learn, we are now opening it up for questions from our provider community on that provider roster.
First of all, before we dive into questions, I just want to pause and take a moment to say thank you so much to Latasha and Michael for taking this time out of their day to walk through the standardized universal roster. I think by taking this important hour, we've all collectively learned a little bit more about the roster, which helps just ultimately support all the work that you do. And so thank you once again. All right, Latasha and Michael, the first question is, do all providers have to utilize the standardized roster when submitting information to the Medicaid MCOs?
Yes.
Perfect, clear and simple and easy. The next one is, if we are a new provider, when should we first submit our roster to the MCOs that we are looking to contract with?
The initial roster should be submitted upon completion of the contract.
Great. Moving along, the next question is, just to clarify, are Medicaid MCOs no longer performing credentialing function? And if we have questions about HFS impact, who can we speak to?
So Medicaid MCOs are no longer required to credential for the Health Choice Illinois Medicaid portion or MMAI. If there are questions in regards to HFS impact provider enrollment or an issue or error on their impact enrollment, you can contact Impact for that information or update.
Perfect. If a provider is looking to get notification from the health plan when they've received that, should they ask the health plan to get that information, or do health plans automatically send out notifications to the provider?
So according to the bill that came out, SB, I think 1321, MCOs are required to acknowledge the initial submission of a roster upon receipt of that roster. So every provider who submits to your MCO should be receiving an acknowledgement of your roster receipt. And then MCOs have 30 days to load your providers. You should be receiving acknowledgement of completion of your roster within 30 days. For a clean roster. If there are issues or items that need to be addressed, you should be receiving correspondence from your MCO on that roster submission.
Perfect. This actually lends nicely into the next question. If a provider submits a roster and there's quote unquote issues with it, how will they receive notification and who should they be working with to rectify?
So notification should come from your MCO's provider enrollment team that there's an issue with your roster. I advise all the providers to always CC their provider rep on those emails to the team that you submit for your roster to be enrolled. That way your provider rep is also engaged in the conversation. You can always include your provider rep as part of the discussion for roster issues.
Perfect, really helpful. Friendly reminder, if you have questions, to submit those via the questions tab. This next question is actually very open, but I do think it's a nice one. What do you think is one of the most common errors with the roster, and what should providers be mindful of as they are submitting roster? I imagine this one is from an individual who might be submitting for the first time.
I can say from a legal standpoint, it really, that's some of the biggest one is not affiliating your providers to all the service locations that they render services to. So when they bill out of that location and that location is not listed on the roster, you run into claim denials and then trying to figure out what the provider working to resolve that issue. But that is one of the biggest ones, not affiliating providers to all the service locations that they can work out of. Another one would probably be your billing name versus your location name and how you choose to bill your claims. That is another one that is pretty key for loading of providers.
Even for the most seasoned of roster submitters, what's something that you like them to remind them, and what would you like them walking away remembering from today's presentation?
To always include all of your providers on your roster, even if they do not have the Medicaid ID. Because your roster and your date of submission of your roster has an impact on your effective date with an MCO. So I would advise all providers to submit their providers on the roster to the MCOs.
That's great feedback. Appreciate it. We did receive a question about HFS impact. Today's discussion will not be walking through the HFS impact or general billing. However, if you are interested in learning more about credentialing and the functions that occur through the HFS impact enrollment system, I encourage you to check out our YouTube page and our website, where you can learn more about general billing and the HFS impact enrollment system further. Great. And then Latasha, it looks like we are ending our questions that are rolling in. However, we do have someone who wanted to connect. Should you want to connect with a provider, should someone like assistance with the roster and would like another training on this, should they reach out to their provider rep at the health plan? Who would be the best person typically at a health plan to reach out to for more questions about the roster?
It is typically your provider rep who can assist you with the roster training. For Molina, we have monthly, maybe every 2-week webinars on provider roster training, and our PNMs are trained to assist providers with that, with any roster issue.
Oh, I think that's a really great point that you just mentioned, that continuous training is happening and occurring. With that in mind, if a provider is interested in registering for one of Molina's provider roster trainings, how would they go about doing so?
You can reach out to either myself or Michael Arriaga, or you can go to molinahealthcare.com for Illinois, and there's our registration for the webinars. It's on that website.
Perfect, super helpful and greatly appreciated. With that, we have no more questions. However, I would encourage all of you who are listening to this webinar to visit our website at IAMHP.net. From there, you can learn about other webinars that are going to be taking place, whether they're complimentary or one of our lunch and learns that take place monthly. There, you'll also find learn more about events that are taking place, both at IAMHP as well as at the health plans. Please note that the events that are on our website are just some of the many and wonderful events and trainings that do take place. As Latasha mentioned, Molina does do a roster training. Please always visit the Medicaid Managed Care websites as well to learn more about what events are taking place and what trainings are taking place. I also would encourage you to like, share, and follow us on Facebook, LinkedIn, Twitter, as well as YouTube, so you can continuously learn more about what's going on with the Medicaid Managed Care health plans and IAMHP. We also have a weekly executive corner and podcast recording where we discuss more topics that pertain to the Medicaid managed care industry here in Illinois. With that, thank you so much for attending. Should you have additional questions, always feel free to reach out to your provider representative, the health plans, or the IAMHP team. We're always happy to help. With that, have a great day, and we'll talk to you soon. Goodbye.